I probably started volunteering on a more consistent basis when I was a teenager, and I began attending Muscular Dystrophy Association summer camp. And that's where we'd go for a week at a summer camp and spend time with an individual camper, a child who had muscular dystrophy, and we'd take care of them for that week. We became their hands and their bodies, because oftentimes we lifted them out of wheelchairs or took them to their activities, put them to bed at night, got them up in the morning, that kind of a thing. I did that every year for about 20 years. And what's kind of cool about that is my kids have recently started getting involved in that. My daughter's a junior at KU. She has been going now 3 years, and my son, he's in his second year of attending this camp as a volunteer. So that was my first initiation into volunteerism on a consistent basis. And more recently, one of the things that we have been doing probably over the last half a dozen years or so is my wife and I began serving food to the homeless down at Grand Avenue Temple, which is 9th and Grand here in Kansas City. Well, you know, what I've found over the years is that the people who we volunteer for, or the organizations who we volunteer for also, are very appreciative of the things that we do, and they are so grateful. But what I found after doing it this long is that I get more out of it, I feel as though, than they do, because it just makes my heart feel good. I feel as though all of us are supposed to do volunteerism. To be a servant to anyone is probably one of the more important things anybody could do. And when I do that, it makes me feel good, and that's probably why I continue doing it. You know, as a physician, we have time off like other people do. We have a very busy practice here at Shawnee Mission, and as a physician, we make it a point to go to church every Sunday, no matter what, unless I'm working here at the hospital, and then we try to go on Saturday nights. But we always make time to do the things we think are important, whether it's church, whether it's family, or doing our volunteer efforts. And honestly, there's not a lot of things going on at 4, 6 o'clock in the morning on Sundays. So we found it very easy to, as long as we get out of bed, and we didn't really have a problem with that, but as long as Sunday mornings were free, and they always are usually at that time, we just make it time to do that, because we feel it's important to take a part of your life and become involved in activities like this that we talked about. Shawnee Mission has always expressed an interest in kind of the volunteer activities, at least that I've participated in. And in fact, I've discussed with the hospital some of the things that we've done, and they've supported us. One of the ways they've done that is saw the kind of interest that we've had in our volunteer activities, and one of the initiatives at the hospital is a physician's well-being initiative, and that is to get physicians involved in group activities to develop camaraderie and just kind of provide activities that physicians can take part in outside of their practice. And one of those has been, I think, kind of stemmed from some of the volunteer activities that we did, because when I mentioned earlier that we were involved in the kids at the church and going on mission trips, one of the things that we did was we worked at Harvesters here in Kansas City, which is a food network organization that collects food and distributes it to the needy. And we've got the physicians here in the hospital involved in going to the Harvesters facility on a Saturday afternoon and packaging food and getting it ready for transport, and just kind of helping that organization with their drive to get food to those who need it. I think Shawnee Mission Medical Center is mission is many things, and obviously one of them, or the biggest part of that, is to serve people and serve the patient and serve the public and the community. And I think that kind of wraps up the whole idea of being a volunteer and helping others who are perhaps less advantaged as we are. And the hospital, whenever you're here at the hospital and you're taking care of patients, you're basically serving these people. You're serving the patient and taking care of them and of all their needs. And I think that the hospital, just being a physician and being a hospital, that's kind of our whole goal, is to do that kind of a thing. My name is Brady. I'm an anesthesiologist at Shawnee Mission Medical Center.